Hi there, this is Dr. April Steele. This is my assistant for the moment, Karen, and this is Peanut. Peanut is a 9-year-old neutered male Shih Tzu, and he's going to be our example today for what we do with a wellness exam. Peanut is here today for his annual exam and vaccines, and the exam is as important as the vaccine so that we can catch things early and treat them early and have better outcomes. So we start and we do a nose to tail exam on Peanut. Karen already put him on the scale, which is over here, and got his weight. She listened to his heart and got his heart rate, and she took a rectal temperature on him. So we look at Peanut's overall weight and overall appearance, and we say that Peanut is healthy looking. We can feel his ribs easily. We can feel his hip bones relatively easily. He's an ideal weight. He has a little bit of an abdominal tuck, and he has a waist. If you look at him from the top, he has a waist. So his weight is good. So we looked at his body condition score and say that he's ideal at 3 out of 5. And we start and we say both eyes are clear and bright and wet, and the whites of both eyes are white, and his third eyelids come up and they look normal. Good boy. And we look in his mouth and we say his gums are pink, his teeth are a little dirty. She does. I said, I have the sneezes this morning. He has some tartar on his teeth, so we grade that tartar as mild, moderate, or severe. And he has moderate tartar only on his bottom teeth. He opened his mouth and look in the roof, look under his tongue. Good boy, good boy. And we look for masses or fractured teeth or anything abnormal. And he doesn't have anything like that, which is great. He just has some tartar on his bottom teeth. Good boy. We feel his lymph nodes, which hang out near his salivary glands under his corner of his jaw. We feel his lymph nodes in front of his shoulders, deep up in his armpits. We turn him around and feel down his body for lumps and bumps. Feel for his lymph nodes underneath in his flanks, and feel for the lymph nodes behind his hind legs. While we have him turn this direction, we can make sure that we don't see evidence of chewing around his tail, because that could indicate fleas. We rough his hair up and look for fleas or ticks or anything, lumps and bumps. We feel his knees and make sure that they feel normal. And he says he doesn't want to extend his knees. There we go. Good boy. We feel the other joints in his back legs. And if anything felt abnormal, we would pay more attention. We lift his tail and make sure that his bottom looks normal. He doesn't have mats or dirty hair. He's been neutered, so there's not much else to look at below. We turn him around and we feel his elbows. Good boy. Good boy. Peanut's being really good, so we're going to offer him a little treat here.
No, thank you.
And he says, no, I had breakfast. I don't want your cookies at the moment. But at least the offer was there. We're going to listen to his heart and his lungs. Karen has already checked his heart rate, which was normal. We make sure his pulse and his back leg and his heart rate actually match as his do. If Peanut were not this cooperative, we would have to hold his, and he were panting, we would have to hold his muzzle closed so we could listen to his heart, because otherwise all we hear is his panting. But Peanut's being an exceptional patient, aren't you, bud? Good boy. We feel down his throat, if I haven't already, and make sure that it doesn't make him cough, and he doesn't have any lumps and bumps through here. Good boy. And he gets turned around a couple more times. We turn him around, we palpate or feel his abdomen, and in doing so we try to pick up the edges of his liver, the edges of his spleen. We try to pick up his kidneys. We feel for anything abnormal, like big lumps or masses. We can feel his urinary bladder, and he has a little tiny bit of urine in his bladder. Well, he needs to go outside when we finish. We can feel his colon. In males, we can sometimes feel their prostate. And in females, we can sometimes feel their uterus. But we shouldn't feel prostate or uterus on a normal basis. So then he gets turned around again. We play spin the puppy on the table. And we use two different heads on our ophthalmoscope to look at his eyes. This one lets us look at every depth of his eye, from his cornea all the way back to his retina, where we can look at vessels and the optic nerve. Thanks, bud. Looking at good boy. You're okay. So we look for any kind of cloudiness. They can get cataracts. Phew, excuse me. They can
Right in the face.
They can get cataracts like we can. They can have all sorts of the same problems we do. Peanut actually has a little tiny mass on his eyelid that we would make notes on his record about. Then we switch the heads on our ophthalmoscope after we look from the front all the way to the back and then back to the front of his eyes. We use the direct light and make sure that his pupils respond normally, which they do. Good boy. And then we get to look at his ears, and this is usually the fun part for most clients, and especially children, because it's a video camera. This is part of our video scope procedures. We look in every critter that gets on the table. We look in their ears with this instrument, and it lets us magnify and see way down in his ear. And his are hairy, but they're clean all the way down towards his eardrum, which if we didn't have the hair, we could focus and see. But he has a gorgeous little pink ear like he ought to. Sometimes the camera can get waxy and slightly out of focus, so we have to clean it. And we look in his other ear. Peanut, we're making the nose itch, son. Here, if you'll hold his nose there. This ear's hairy too, but it's clean also. We like normal, clean pink ears. And if his ears were a little bit bigger and the hair wasn't quite so much, we could see his eardrums from here, which is what we want to do. But his ears are clean.
Good boy.
Good boy, Peanut, bro.